Okay, so hi, I'm Dr. Sawa Chowdhury. I'm giving a little talk about why I think occupational medicine is an excellent career opportunity for those who are considering a career change or a different specialty. It's useful because not only can you work in the NHS sector and the public sector, but also in the private sector. So something to consider. Um, I believe. Yeah, I've been an occupational health physician for the last 3 years, and I believe it's a very good career. I've not changed my mind at all, no regrets. And in fact, I've helped, I think I'm counting about over 60 people, doctors into the field from other specialties now. And I do a lot of other things to try to promote the cause. So hopefully you'll find this useful. So what I was going to cover today is what occupational medicine is, why we should be choosing it or considering it as a career, the different routes that you can go into occupational health and become an occupational health physician, and the different levels of specialty and specialism within occupational health as a career. My own career route to date, the plans for the future, and where I'm heading myself. A little bit about what it is like in the day in the life of an occupational health physician. I'm going to also touch a little bit about how the COVID pandemic and the OH input has been useful to the whole scenario. A little bit about the role of the Society of Occupational Medicine. A little bit also about the Occupational Health Academy, which may be useful. It's a course that I run with Dr. Claire Fernandez to help people pass the exam, the DOC Med exam, and enter into the field and give an opportunity for people to ask questions at the end. So, a little bit about myself to begin with. How did I get into occupational health? Well, I did my medical school at Barton in London, and did my foundation years FY1 and FY2, like most people. I at FY2 didn't really know what I was going to do with my career, so I decided to take a year out, which I know is quite popular amongst most junior doctors at this stage. And I worked in a variety of specialties within hospital medicine as a locum, and just was trying to figure out what I wanted to do. I thought about GP, I thought about surgery, I thought about psychiatry, but eventually what I did is did a GP entry exam, got a place, and then had a few months left of my year four or F54, so as to speak, and then decided to go for disability assessments just to see what it was like. I found that very in keeping with what I was expecting. It was a good work-life balance, a good salary, and it was just a different outlook in medicine. So using your medical knowledge, writing reports, applying it to certain law and legislation, and I found that very interesting. So I stayed there for about 3 years, did a bit of training for other doctors, nurses, and physios, and stayed there for a few years. I then looked for the next step, and that is where I found occupational medicine. I did the diploma of occupational medicine, which I'll go into a bit more detail shortly, in 2018, and then 6 months later, I was offered an interview, and I have been working with Medigold Health since, who are a private occupational health service company. So what is occupational medicine? Occupational medicine in a nutshell is looking at the effect of health on work and work on health. Um, it's really fascinating and interesting. It's outside of the box. You're looking at law, you're looking at ethics, you're looking at hygiene, and you're looking at medicine, and all those four components blend well together, and give you essentially another specialty. Um, we're the bridge between the employer, the employee, the GP, the specialist, and any other treating clinicians. And there's a lot of ethics involved, a lot of law, as I said, and you provide your advice essentially, and give fitness work advice in a variety of situations. There is a range of there is a range of assessments and aspects for an occupational health physician to embark on. Um, it can start from anything from health prevention and promotion. You can be involved in things like workplace risk assessments, site visits to try to see what the level of risk is, try to quantify that risk, suggest any control measures to mitigate that risk, and certain law and legislatory requirements as part of the health and safety law. We also do things like health surveillance, which can either be statutory, depending on what law and legislation it's required under, or periodical health checks to just make sure that someone's health is okay and that there isn't anything untoward ongoing that could impact their own health and their own safety within the workplace. We can do medicals for work, so there's specific medicals such as train driver medicals, bus medicals, diving medicals. It can also go into things like asbestos medicals, lead medicals, ionizing radiation medicals, and a whole variety of subspecialty types of medicals to ensure that they are fit to do their role. Those again are either statutory, or we can do things like pre-placement medicals. So somebody's applying for a job and they want to make sure that they're fit to do that role. And that's part of it. And that's essentially the kind of proactive way to give fitness for work advice and ensure that somebody is fit for their role. We also do more reactive medical assessments. So when someone's been off sick or there's a concern regarding a particular person in view of their health and work, and a manager may refer somebody, and that we would go through their occupational history, do a clinical exam, a clinical history, an examination, a functional history and assessment, and then give our fitness for work opinion and address any questions. And I will give an example report later on in this presentation to give you an idea of the kind of thing that we would be doing. And also, we look further down the line when somebody's health is very severe, their function is significantly debilitated, and they're unable to do their job or any other job, and they might be looking at retiring on health grounds early. And ill health retirement assessments and pension assessments is something that an occupational health physician would be advising on based on the particular job role and the pension criteria that they fall under. And I've also gone through some subspecialties already, but there's oil and gas, there's aviation, police, diving, firefighter, travel medicine. Those are just a few to name, and there's so many out there. And depending on what tickles your fancy, you can go into that. You could do a bit of both, and it's excellent for a portfolio career, for example. What are the routes to get into occupational medicine? Well, first of all, occupational medicine is in itself a specialty. It's part of the Royal College of Physicians. It's got its own faculty called the Faculty of Occupational Medicine, and essentially there are two types of training routes. The training route, the typical ST3 to ST6 to consultant level, but also the non-training route, the CSER route, which a lot of people embark on, which is a little bit more flexible. But again, the end goal would eventually to become a consultant, and the equivalent of what a CCT would have done. You can be a generalist occupational health physician, so just having done the diploma of occupational medicine and stay there, or you can become a specialist, so you can be a registrar, ST3 to ST6. You can become an AFOM, which is not an accredited specialist but an associate specialist, and that's having done the exit exam and the part MFOM Part 2 exam, or an MFOM, which is a consultant, and you're either a CCT or a CSER accredited specialist, and the end goal is essentially the same. A little bit about the training route. So this has recently been updated as the occupational medicine curriculum has changed, and the National School of Occupational Health, which is the body that you apply through, has changed their requirements and personal specification. But largely speaking, you need to have done your FY1 and FY2. You essentially need to have done 2 years after FY2 in any of the fields of pediatrics, psychiatry, medicine, surgery, public health, whatever it is, even ACCS and GPST. There's a whole variety, and I've listed a few there, but actually it's become more inclusive now. And I would suggest going on a National School of Occupational Health website to have a look at it in a bit more detail and see what applies to you. But once you've done 2 years after FY2, you can then apply through an interview program for ST3 to ST6 training, and to get essentially a registrar number. And you do that through the National School of Occupational Health. There's an interview system, there's a scoring system after, and you would then eventually get a number and a deanery and a location allocated to you. You can also take that number, and there are a number of private occupational health services who have training numbers and have the facilities to essentially take on an ST3 to ST6, and that would be the equivalent of training in an NHS department, but in industry, which has its benefits and cons too. After that, during your ST3 and ST6, you would be expected to sit the MCQ exam, which is the MPhil Part 1, as well as the MPhil Part 2, which is three written exams, as well as an OSCE, a clinical exam. And by that, you would then have done all the exams and be essentially at a consultant level in terms of knowledge. However, you would also need to pass your ARCPs. You need to demonstrate against the occupational medicine curriculum that you have satisfied the relevant outcomes and essentially prove that you have the experience and the knowledge and the competencies that a consultant would be expected to have. Occupational medicine was until recently one of the only specialties that requires you to do some form of dissertation or research in order to complete the curriculum, but that has changed a little bit and is a bit more flexible. However, audits, research, teaching, management, leadership, there are loads of other competencies that you would look to fulfill, and the occupational medicine curriculum can be found on the Faculty of Occupational Medicine website. After all of that, satisfying your ARCPs, having done all your exams, after ST6, you will be given the Nomials MFOM, and you're essentially on the specialist registrar on the GMC, register on the GMC, and an accredited specialist in occupational medicine. So the non-training route, the key difference regarding this is that it's mainly industry only. So you're not part of a formal NHS training program, an ST3 to ST6. However, the Faculty of Occupational Medicine have specified clearly what they believe is required in order to be able to embark on this. And in order to sit certain exams, you have to have had a certain amount of pre-occupational medicine experience and occupational medicine experience. For this, you need to have done your FY1 and FY2. You need to do 2 years after your FY2, whether it's called training, surgical training, GP, or any other experience. A lot of the kind of foreign doctors do demonstrate that experience in other ways, and as particularly if you have kind of part-time and different specialties and moving around, and your career history is a little bit more complex, certainly you would need to prove that and check with the Faculty of Occupational Medicine that you have met 2 years equivalent experience after FY2. Once you have that, you can then embark on the exams. I mean, the Diploma of Occupational Medicine you can actually sit straight after FY2 and fully registered on the GMC. However, the MPhil Part 2, you would need to prove that you've had that experience. Most people sit the Diploma of Occupational Medicine and get a job with an industry or a private sector company, and that's the MPhil Part 1, so the MCQ as well as the Portfolio and Viva exam, and I'll touch on that a little bit later. After that, you'd sit the MPhil Part 2, and you would do your written exams and you would do your clinical exam, and then essentially you'd get the Nomials AFOM, which is an Associate Specialist in Occupational Medicine. By that, you're essentially a middle grade, and you have done the exit exam, but you're not quite a consultant. Much like with ST3 to ST6, with the CSER route, which is a bit more flexible, you would need to prove that you have over 4 years of full-time equivalent experience, and you would also need to tick those boxes on the occupational medicine curriculum and demonstrate evidence and skills that you have that would match what an ordinary ST3 to ST6 would do. And after that, once you submit to the GMC and the form and they've checked over and they're happy that everything has been met, you would then be given the Nomials M form. And although this is slightly different because you're an equivalent of a CCT, you would still join the GUMC Specialist Register as an accredited specialist in occupational medicine. A little bit about the day in the life of an occupational health physician. So for me, it can vary, as I said, from a company to company, but this is what I would typically do. It's a 9 to 5 job largely, but I get in a little bit early and I prep my cases. At Medigold, we have 4 45-minute appointments before lunch and then 4 after lunch. I tend to have an hour lunch, so 30 minutes admin and 30 minutes unpaid lunch. And that's enough time for me to rest my brain, clear up things in the morning, even prep a little bit for the afternoon if I need to. I then complete my 4 cases in the afternoon. I get an hour admin time in the afternoon to answer any emails, respond to any queries, any complaints, finish any reports, and do anything else that is needed. And then my day is ended. There is some flexibility, obviously, around the administrative time, and that can be useful for things like collecting your children from school and any other commitments that you might have, or even just avoiding the rush hour. So something that I have found useful. Now there is more home working than before with the COVID impact to services, and actually video telephone consultations are very common. However, you can still go into the clinic, particularly for safety critical stuff. You need to do an examination and assess their physical functional ability in some regards, like hearing or vision, and that would require you to go in. There's also things like visiting certain sites, so visiting an office, a place of work, a factory, anything that is required to just see the place of work and do things like risk assessments, see the employee in their workplace and how they are managing. The good thing is that there's no weekends and there's no evenings normally, so it is very good for work-life balance. On the right there, I've listed quite a number of things that we go in, which I touched on a little bit earlier. It isn't just doing management referrals, although the majority of people do that, and that's the majority of our work. But we can do a lot of other things like health surveillance, looking at test results, looking at pension applications and applying the criteria and giving our opinion, supporting other colleagues. Things like pre-placement, pre-referral calls to make sure people are fit for the role and answer any queries management and HR might have, looking at the letters that have come from the GP and consultant and writing letters to them to request certain information, the business side of occupational medicine, as well as things like the site visits and risk assessments that I mentioned before. I'm not sure you can see very clearly on the screen, but a typical report would look like I've listed below. You would be doing an occupational health, occupational history and the background of what they're doing, what their work involves, how many hours, any adjustments, any restrictions that they may have already. In the sort of medical factors, you would do a clinical history, you would do a functional history, you would also do an exam. So this is very much in line with what we're used to doing as doctors in the NHS in other fields. So it's just an important thing that you are still a doctor. You still do use your knowledge a lot, but you combine it with other parts of your knowledge that you learn along the way. You give your fitness for work opinion in the opinion and outcome section. You would give a little bit of recommendations of what the management need to consider, but also the medical and legal and ethical reasoning behind that. And then there would be a section to answer any specific questions that management may have asked, particularly management referrals, where they want to know about certain things, about when they will return to work. Are they safe to do a particular task? Is there any other implications and things they need to consider? There would always be a section where you would put about the Equality Act and give your opinion about whether they fall under the disability provisions, and things like whether you need to see them again or not and what the recommendations are, and to finish up and a little bit about the consent and the GDPR data protection aspect. So just want to run through again about my career at the moment. So for me, I've done the Diploma of Occupational Medicine in November 2018. I have started to do the MSc at Manchester University, and that is an academic qualification. It's not necessarily needed, but something that I felt would help with my general knowledge of occupational medicine, but also help tick some of those boxes of the occupational medicine curriculum. So essentially killing two birds. I'm in my third year of the Masters as we speak. I've also managed to complete the MPharm Part 2 exams last year, and I'm now an APharm, so an Associate Specialist in Occupational Medicine. So what I've got left really is the dissertation to make sure I've done all the other competencies, gather all that information, send it to the GMC, and essentially try to prove that I have the equivalent experience of an MPharm, and I hope to do that in 2024. And hopefully, if everything goes right, I'll end up as a consultant occupational health physician and join the GMC register as an accredited specialist. So, some of the pros and why I think everybody should be considering occupational medicine as a career. It largely involves 9 to 5 work, no nights, no weekends. The salary is very competitive, and depending on your experience, you can often break the 6-figure barrier. If you want to do part-time remote working, etc., there's lots of flexibility around that, and that's why it's a very popular and attractive career. Mainly office-based work. You do work in a corporate environment. Obviously, there are some NHS works you could work within an NHS hospital, but there is obviously a lot of travel and a lot of working from home if you want it to be that way. But there is a lot of flexibility depending on what you require. You get a lot of time for your appointments up to 1 hour, so there's no pressure like GPs may have when it's 5, 10, 15 minutes. You get a lot more time. You can really delve into certain clinical aspects and give your opinion and give any advice that you feel necessary. The wide variety of types of assessments I've already highlighted as well, so you're always kept on your toes. And I think the key for any career is to try and be variable and make sure that you remain interested. A wide scope of medicine, so mental, physical, the biopsychosocial model. There's a multidisciplinary team input often, so you're seeing OT reports, physio reports, specialist reports, psychology reports, the whole range of it. There's a lot of training progression. There's a lot of subspecialties, so you can always pick what you like and where you want to go with your career. You don't have to stay a generalist and stay very bog standard occupational health physician, or you can if that's what you like. There's so much variety and choices. There is some risk, but it's a lot less. You're only giving your opinion only, and you're using the medical and legal knowledge to do that. A lot of the onus and health and safety law places the onus of for on the employer. So you're more advisory in nature, but obviously a robust justification of why you're giving your opinion is imperative in any occupational health report. I've mentioned about remote working, and obviously, if you do go into the office and you do like to dress up and you do feel and you want to feel comfortable and feel happy in your environment, then you can wear things like nice watches and shoes, and I particularly enjoy that myself. There are some cons to think about also. One of the things is that no one really knows what you do, and explaining this again in this presentation, I've done 5 presentations now for the Society of Occupational Medicine about a career in OH, and I still get asked every time whether I'm an occupational therapist, whether I just do vaccines, or whether I do a lot more. So you do find yourself having to explain yourself a lot. There is a non-treating aspect to it, so you don't really write prescriptions, you aren't really chasing a lot of blood test results and things like that, and a lot of people do miss that element of it. There is some stigma associated with choosing this career, particularly if it's a non-NHS role, but I guess that's something that's becoming more common, and there's less stigma associated. And also, a lot of the people that you do end up seeing are more kind of one-off assessments, so you do lose that follow-up, although that's not always the case if you're in an in-house company, occupational health department, or an NHS department. You may end up seeing the same person over and over again. But the key message here is that the pros clearly outweigh the cons. So I wanted to also touch on what the COVID-19 and role of occupational health has been. As you know, it's been a real struggle within the economic and the health aspects of the coronavirus. But occupational health has been heavily involved, even if it's not well noted. We have been advising employees about social distancing, self-isolation. We've been highlighting those that are very vulnerable or highly vulnerable or extremely vulnerable, and what the work need to consider in terms of health and safety legislation and mitigating any risk to that employee. We've been talking about policies, environmental law, duty of care that the employees may have. We've also been advising key workers and NHS staff about working and whether they can and in what particular context. There's also things like testing and screening for COVID in particular and other results, and giving the outcomes for that. The safety critical medicals have continued. Obviously, lorry drivers and bus drivers and train drivers need to be fit in order to continue doing their role. So that has continued throughout the pandemic, although it's largely been a remote service. Dealing with physical inactivity and mental health, there is a lot of adverse effects of socially distancing, and that has been the forefront of what occupational medicine often have to deal with. A lot of people have been furloughed, have been off work, and this has been affecting their overall physical, mental well-being. Lobbying heavily for PPE has been one of the aspects of occupational medicine, as well as other aspects such as the contact dermatitis in NHS hospitals for washing their hands, the financial worries, the job insecurities, and how redeployment has been a consideration, particularly as organisations feel the strain from the economic aspect. Public Health England, so the guidelines from fact from fiction. So often I'm explaining the PHE guidance and whether someone's clinically vulnerable or clinically extremely vulnerable and what that actually means. And of course, reviewing the risk assessments of the workplace and whether they're fit for purpose and are they complying with health and safety legislation. I wanted to just introduce the Society of Occupational Medicine because I believe it is a very a key organisation to consider joining and consider contacting for support in occupational medicine. It helps a variety of vocations from doctors all the way to technicians, and is the oldest organisation for occupational medicine. There's a whole host of benefits for that listed on the right there, but the main thing is that they connect you to other occupational health physicians. It is a relatively small specialty, and I would imagine the majority of occupational health clinicians, whether it is nurses, technicians, or doctors, are a member of the Society of Occupational Medicine because there's a lot of useful benefits for that. The other thing I wanted to highlight is for those who are considering a career in occupational medicine and health, in order to pass the diploma of occupational medicine exams, Dr. Claire Fernandez and I have set up a revision course, the Occupational Health Academy, and this helps those new occupational health physicians try to get past the exam, which is normally essential in order to start work as an OHP. And we cover the three types of exam aspects for the DOC Med. We run this course in addition to the other CPD courses, and it has been very useful and the feedback has been excellent. I think we've now helped over 200 OHPs pass the exam and with good marks and good feedback. So please do consider it. The website's there. Our next course is actually in March 2023. So you can see already that there's been a lot more courses since this slide was made. Okay, and that's the end of my presentation. So I know there isn't really a question and answer facility with this, but if you do feel that you want to get in touch and find out a little bit more, feel free to visit the website for the Occupational Health Academy. There is also a Facebook page. You can contact me on LinkedIn. There is also the Society of Occupational Medicine, for which I'm an outreach officer, as well as the CSER SOM representative. So I am happy to receive any emails and queries and try to guide you in the right place to find out the information that you're looking for and any specifics that you might have. But thanks for listening. Hopefully this has been useful and you're considering a career in occupational medicine, and I would encourage you to ask more questions and perhaps get some shadowing and get talking to a few people if you're thinking about this as a career.